Hi, and welcome to Product Talk Showcase. I'm Mike Hughes. I have with me today Dr. Nelson Hendler. Dr. Hendler was former president of the American Academy of Pain Management and former president of the Reflex Sympathetic Dystrophy Association of America. He has written 3 books, over 30 medical textbook chapters, 58 articles, and is widely recognized as an expert in chronic pain diagnosis and treatment. Dr. Hendler, welcome.
Thank you very much, Mike, for having me talk to you. Basically, there's a variety of reasons why patients are misdiagnosed, and I'd like to tell you why that happens, what are the most commonly misdiagnoses, and then how you can get a more accurate diagnosis to take to your doctor.
Okay, doctor, let's talk about misdiagnosis with neck and back pain.
Sure, thank you, Mike. I've published several articles showing that at least 40% up to 67% of patients with chronic pain from their neck and their back and their arms and their legs were misdiagnosed. And they were misdiagnosed for a variety of reasons, but the most common error seemed to be the doctors didn't spend time with them, which I'll discuss in the next slide.
Okay, doctor, now let's talk about why patients are misdiagnosed.
Okay, there are a variety of reasons for this. I'm sure you've all experienced the fact that doctor is rushing you in and rushing you out of his office and doesn't take enough time to really listen to your complaints. But there are other more subtle problems. The most common one is the fact that doctors rely on anatomical tests to try to diagnose a physiological condition. Now, what do I mean by that? Physiology is doing something to a body and measuring the response. Well, pain is a physiological condition. You can't see pain, you can't measure pain, you can't take a picture of pain. And the best analogy I could give you is you had an oven up on the wall, and I took a picture of the oven and I handed you the picture. I say, look at the picture, tell me if the oven is hot. What could you say? You couldn't say anything. But if I put a thermometer in the oven and the thermometer said 375, you could tell the oven is hot. The thermometer is measuring a physiological response. It's measuring heat, while the anatomical picture of the oven doesn't tell you anything about it. So what we really have to think about are what are the physiological tests that could be used to help establish a diagnosis to get rid of your pain. Because you notice I didn't say establish the diagnosis of pain, because pain is not a diagnosis, it's a symptom. So the tests that can be used are tests that measure how the body responds to certain things. And these are provocative discograms and facet blocks and root blocks and nerve blocks and bone scans, neurometer studies for sensory nerves, indium scan, gallium scan, PET scan, etc. These all measure how the body responds to certain things.
Doctor, are there some other causes why patients are misdiagnosed?
Sure. The best way of thinking of this is giving you a flat tire analogy. You can have multiple causes for a single symptom, just like a flat tire. You can come out, you say, I have a flat tire. Well, does it have a nail in the tread? Does it have a leaky valve stem? Does it have a cut sidewall? Is the tire off the rim? Makes no difference. The bottom line, any one of those can cause the tire to be flat. And more importantly, you could have 2 or more or 3 or 4. All of them could cause the tire to be flat. And if you only fix one and the others are still existing, your tire is still going to be flat. So you have to realize that you can have multiple causes for the same symptom.
If you wish to find out what is really causing your pain, visit DiagnoseMyPain.com. For only $49.95, you'll take an online medical questionnaire. It has 72 questions with 2,008 possible answers and is computer scored. It will take you only between 20 to 60 minutes to complete the test, and your results will be emailed to you directly in just 5 minutes. The test will give you diagnoses, which correspond to the diagnosis from Johns Hopkins Hospital staff diagnosis 95% of the time. Take these diagnoses to your doctor and have him confirm them, and then order the right test to get you the right treatment. Thanks for joining us on Product Talk Showcase.